depend on where you are. I am the regional advisor on mental health for PAHO, and I'm happy here to be introducing this sixth webinar of this series, Basis for the Change on Mental Health in the Americas. Some practical terms. This webinar has simultaneous interpretation. At the bottom of your screen, you will find a little globe in which you can click and select the language that you would like to listen to your presentation. At the same time, I would like to ask you if you have any questions during the presentation, you can introduce them in the Q&A icon that you have also at the bottom of your screen. So there you can enter your questions and they will be answered at the end of the session. Without further ado, I will welcome Carmen Martinez, which is a regional assessor for the mental unit in the Americas region, who's also going to give us some welcoming words. Thank you very much, Matias. Good morning, everybody. Welcome to this sixth webinar on this basis for the change in mental health in the Americas region. I'm really happy to welcome you today to this important event, which is called Transforming Health through the Information System through the WHO and the PAHO. We would like to highlight how important this topic is that gathers us today. Let's remember that in the Americas, the mental health has a very significant burden. They constitute like 1/3 of the years lived due to disabilities. They include all types of mental diseases and neurological diseases, and also the use of substances. The policies to improve mental health and the strategy to prevent suicide in the Americas since 2023 stipulate as a strategy the strengthening of data, evidence, and research in terms of mental health and use of substances. The goal of this webinar is to understand widely the information system in mental health, because this is an action-oriented system. It's not only to gather data, but also enables the decision-making for the mental health system. Today, we have experts in the field from PAHO, from Chile and Argentina, who are going to share their knowledge and best practices. We hope that this exchange will inspire us and provide us with new tools to improve mental health in the Americas. I honestly thank you for your participation and the support from the local offices and all our expert colleagues. So let's make the best of this webinar today. Thank you. Thank you very much, Carmen, for your kind words. And now I will give the floor for the first presentation that we have today. During the next hour, we are going to review the agenda, and during the next hour, we have several presentations. After the presentation, we will have some time for Q&A on the presentations. Without further ado, let's start with the first one. I'm happy to introduce Ramon Martinez, which is specialist in health metrics in the Department of Non-Communicable Diseases and Mental Health in the Washington office. I will start with some introductory slides, and then I will give the floor to Ramon. Just give me one second, I will prepare my presentation.
Bien, muchas gracias a todos por estar conectados.
Thank you very much for being here today. I will make the introduction for this webinar on the transforming mental health through the information system. But I would like to start by giving you some context that might be important to know why we have this title, this specific title. And there are 4 points that I would like to highlight. The first one is that any health program, whether at a national, local, or regional level, needs timely and relevant information in order to monitor the actions implemented and also to improve to inform the improvements in the providance of services. So we would like to know that if we have any change implemented, we need this information. But with many countries, the data related to mental health is very limited. We know that we have only 1/3 of the countries that share information about mental health in a public sector, and only 1/4 of these countries contribute to the health with information related to psychosis. In this sense, we need that the quality and completeness of data is available. We need a regular measurement of the situation of mental health in the countries, because this is a tool that enables us to have updated information. But we need this to be more regularly, because we need to gather data more often, at least once a year, in order to see the changes that are being made and make the adjustments of public policies. And in the fourth place, to acknowledge that the daily measurements of our acceptance and quality and the results of the mental health services also does not exist in some regions. So by knowing with this motto that improving the information systems, it's good for all of us. It's not only what we said, but it's all the countries. We have an integral action plan about mental health whose aim is to strengthen the leadership and governability, to provide integral services and accessible services, to calculate every 2 years basic indicators of mental health by means of a national system with a world goal that to unify the mental health information for 2030. But this information is based on these information systems that we are seeking. These are the goals of the Sustainable Health Agenda for the America. I'm sorry, this information is in English, but just mainly is for you to see the goal number 6, which is basically to strengthen the information system to support the development of evidence-based policies and decision-making. In this sense, we find once again that we need to have mental health information system, and the policy to improve the mental health, which was approved by the member states at the regional level, also is aligned with the strategy number 5, which is to strengthen data, evidence, and investigation in order to establish uniform indicators, but also to integrate the information about mental health into the national systems in order to gather systems and improve the accessibility to services. The truth is, nowadays, this is on the left, we have the availability and report about mental health at the global level, and in the third level, from left to right, we have the Americas region. If we compare only those 2 columns, the global and the regional data, we find that at the global level, only 85% of the countries gather mental health information during the last 2 years. In the Americas, this is decreased, and we find that only 75% of the countries gather data during the last 2 years. And if we disaggregate this data, we find that most of the countries of the Americas also include mental health data in general statistics. This means on how are we integrating mental health information in the general health information systems. We have 13 countries that for 2025 have as a goal to be able to gather, analyze, and notify a basic set of indicators about mental health within a national information system. So the most important task, this is that a huge endeavor, this is shared by different countries. We see improvements here, but we also acknowledge that we'll still have lots of difficulties to move forward in this area. This is why we are going to present you with some tools that we design at a regional level so that countries may use and thus review their information systems. So which data or indicators do we need for this mental health system? We need to acknowledge the magnitude of the problem. We need risk factors, indicators related to well-being and the load of the disease. Also, we need to see the scope of the policies, the legislation, interventions and services, data about the sanitary system, about the social and economic results. This means to understand the intersectionality of mental health, the importance that mental health is included on all policies. So the data does not only limit to the health information system. Now we'll give the floor to Ramon, who is going to talk about a system about visualization and report in order to be able to review the national, sub-regional, and regional information. You have the floor, Ramon. Thank you very much. It's a real pleasure to be here today with all of you. I'm going to share my screen.
Bueno, yo voy a conversar un poco de algunos recursos de información que
I'm going to talk about some of the information resources that we have to support the decision-making process, how to improve, in order to improve the mental health services. I'm going to talk about two basic elements. I'm going to present you this portal, the data portal, which is called Enlace, developed but non-communicable diseases of the OPS. And then we are going to review an interactive tool which is specifically related to mental health, which includes a variety of information and indicators which are specifically aimed to improve and monitor the advancement of mental health in the region. First, I'm going to talk about the department about NCDs, the non-communicable diseases, through the use and spread of information in order to support the decisions made at the department inside the organization, and also to orient the technical orientation in the countries, and also to provide reliable, valid, and comparable information for all countries so that they can monitor their own national programs. I would like just to give you a brief look at this portal of information. Here you will see the site and a brief, I'm sorry, this is in English, but this is also available in Spanish. This is arranged in such a way that we are using some visual aids some key data related with NCDs and mental health. And then we are providing about risk factor, the burden of diseases, which are interesting from the specific departments. You will see that each of these blocks is related to one specific topic, which is interactive, so where you can see the information, you can explore. I will show you an example briefly, but just take a look at the diversity of the information that you see here, which is related to for mental health. For example, we have different mental, neurological, or use of substances, even drug and alcohol related information. For example, if I click here, which is at the burden of neurological diseases, you will have an introduction, and then you will have an interactive information with different diseases that you can select. You can select the epidemiological measures related to mortality, to burden of disease, even the years lived with disability, and the years lived with disability, for example, due to these conditions. The information is presented with maps and with bars to complement the map. We do it this way because we have a series of small countries which are not seen on the map very clearly, so that's why we have these bars also. Here at the top, we have different buttons through which we can see trends. So we have a series of visual aids that allow us to explore this data. We also have an option to visualize tables of data that can be downloaded to make a future analysis that you may need. This is taking a while, but I would like to show it to you. By the download button there, you can download this information for you. I will move to the following item.
This is in relation to the data portal, and as I was telling you, there is a great deal of information. You can see the table with different measures, and you can use the columns on the top, the filters, so as to select the data that you are interested in, and then you can download those data. I'm going to go back to the portal, to the main, to the homepage. This is about neurological conditions, but we also have information on a risk factor group, which is related to non-communicable diseases. We have malnutrition, violence, rehabilitation data. There's a whole other group of interactive tools that allow us to monitor the implementation of public policies and action plans in different thematic areas of the department. And we also have information on some population surveys that the department, where the department cooperates so as to collect those data. Now I'm going to go on to the next topic, which is related to mental health, and that it's that we created an interactive tool that basically uses two sources of information This interactive tool is the Atlas, the Mental Health Atlas of the Americas, and you may know this tool already, which collects information on availability and accessibility to mental health services and different resources of mental health as well, included the implementation of different public policies and strategies to strengthen mental health services at a local and national level. We have created this interactive tool which uses the World Health Estimations, which is disaggregated by country, condition, sex, etc. And we are also using a group of indicators which are collected through the Atlas tool. So we have grouped information in terms of mental health products or epidemiological measures related to mental health. And we are also introducing information on governance and leadership and information on services, on the implementation of prevention programs and promotion programs as well, and specific information on information systems. So that's the home page would be of the tool, and we can go and check this information by clicking on these blocks of information. I'm going to go into the governance block just to give you an example on governance and leadership. As you may see, we can see governance and leadership here, and you'll see that the tool has a menu here on the top, which allows us to go to one topic to the other, but broadly speaking, generally we can select the area we're interested in the map. For instance, I may be interested in knowing the status at a national level of legislation or specific action plans in each of the countries, for instance, and the tool will show us in colors which is the state that has implemented or not the action plan and the policy which was selected. Well, so here we have a graph that shows us summarized information, the number of countries according to the category of the indicator which is being collected, and the list of countries with its implementation status for that indicator. If we go to the access to services section, you can see, and that's similar to what Matthias was mentioning. There are countries that have data, others that don't. And this is quite a challenge. And we are calling upon the countries to report this data. And this situation is reflected in some indicators. Here you can see that there are a number of countries that do not report the indicator which was selected. We are generally presenting information in the shape of a map or horizontal charts. And here we are talking of the admission rate of a mental health hospital every 100,000 inhabitants, but there are other indicators that you can visualize and you can select here. Generally, in the Atlas, we have different indicators which are included in this tool. If we go on to prevention, this works in the same way. There is a great amount of indicators you can select from. You can also select a specific subregion, for instance, if you're interested in knowing about it. Using color codes so as to identify which are the countries that have implemented the specific program which was selected. There is also information on information system, and this is a similar template in which we are presenting the information in the shape of a map in a summarized way. With these horizontal bars, graphs, and the indicator which was selected in this case. And here we're presenting information on the capability of countries to report, to compile and report data disaggregated by age. But there are other specific indicators you can select and show. I'm going to finally show here the epidemiologic measures in relation to mental health. This is a similar map to the one we showed before, but you'll see here that we have a small button where you can show the type of presentation of the information. So here we are presenting the standardized rates, mortality rates adjusted by incapacity in the Americas region for suicide, and you can select the indicator you would like to show. For instance, you can select mortality or death. And here we are showing the trends of the observed series of information, but we are also giving information on a forecast, a future forecast until 2030 of each of the geographic areas that were selected. The geographic areas could be selected here, can be selected here. You can select a specific country. I'm going to try to include Argentina, for instance. I'm going to apply it, and you'll see how Argentina appears in blue, and you can compare Argentina to the rest of the subregion in the Americas. So you can play, let's say, with this information in an exploratory manner. So I just would like to share that this tool we have just created, and we have created it with the purpose of supporting and enhancing the monitoring of mental health services. So I'm going to stop here, and I am at your disposal to answer the questions you may have. Thank you very much. Thank you, Ramon. There is a great deal of interest in this tool because these are very novel tools and they allow us to deepen on the knowledge you have on different metrics in mental health. I would just like to tell you that the portal has been there for a while, but this part shown by Ramon is a new platform, so it won't be available during the weekend. We are reviewing it, and we want to be sure that there are no mistakes there, but then you will have access to it. Thank you very much, Ramon, for your support. Yes, I just wanted to share one more second for those who are interested. Here you have the links, both to the data portals, Enlace, which has been working for a few years and we have been improving periodically, and there is a link to the visualization I have just presented, but as Matias was saying, it is still being revised and approved. But you have the links here to both of the tools. Thank you once again, Ramon, and now we're going to give the floor to the team of Argentina with under the title An Argentine Experience to strengthen the information system of mental health. We're going to have Narena Ayala, PAHO consultant, Liliana Urbina, and Magali Gaudio, also expert for monitoring assessment for mental health for PAHO and WHO Argentina. Thank you. Good morning, good afternoon. I don't know if you can hear me well. Yes. Excellent. Thank you. Well, thank you very much for inviting us to present our experience to you, which was initiated here in Argentina in 2022, when we started with its implementation. Argentina is one of the countries, as you may know, that are part of the initiative, special initiative for mental health, together with Paraguay. These are the two countries in the Americas region. Can we move on to the next slide, please? Thank you. This is just for you to have some images. I'm going to do a brief introduction about the work we are doing in order to give you some context on the work we are carrying out. This was launched in Argentina, and it's a program that works on different areas. First, the desinstitutionalization, and on the other hand, the development of services and the development of first and second level services in an intervention which should be comprehensive, which right from the beginning, it has a monitoring and assessment program. This slide is just to show you some of the activities. We have it's a federal country, so we have been carrying out activities in different places within these areas of work. And let's move on to the next slide. Thank you. The idea is to do advocacy and to monitor and assess all the actions that we've been carrying out. This was agreed with the country, this special initiative, within a logical framework of planning, strategic planning, which was agreed on at a national and subnational level, which is where we are intervening. And as I was saying, on the one hand, we would like to enhance the desinstitutionalization, advocacy, human rights, second level services, integrated with other networks of health services, and on the other hand, to move forward on the first level assistance with the MHGAP program. Since day one, and that's something I would like to convey to you, the challenge was to follow up this planning with a monitoring and assessment program or framework, which requires the quarterly collection of data on all the activities we have been implementing. That is, in all the actions we carry out. But specifically on the implementation of MHGAP on the first assistant level, we have worked together with the ministry so that this data collection can be done in a systematized way and regularly. I mean, we started doing it in quite a manual work, getting in contact with the different jurisdictions we were working with. Magali will explain this further, and then it's quite difficult. For instance, we sometimes have, well, the sources from which we collect data are not always easy to get, or they are not always up to date. That makes it difficult. In Argentina, we call, well, it's something difficult. It's a work that is really tough because we don't have, we are not used to collecting data and to analyze those data and measuring the work we've done and knowing whether it is having an impact or what is the type of impact it has been having or the outcomes. An example could be the implementation of the program to reduce the gap on mental health, MH gap, which has been implemented in the country since, I don't know, it was launched in 2018, 2019, then we relaunched it in 2022, and even though the program is implemented and people are trained, then we don't have a real idea of up to which extent the practices are effectively changed.
This also includes who are participating in this MH gap program, because we are overworking with our work contracts, so this is not in favor of our data gathering activity, because this ends up being like a burden, so we can't understand what's the need of this work, especially when the data it's not gathered, analyzed, and then provide an outcome. So in this sense, for us, it has been very important to reach an agreement with the Ministry of Health, so that the ministry itself, and I also add that this is a priority for the ministry, of this monitoring system to strengthen the information system. Therefore, working together with the ministry will allowed us to make progress. So to measure the first level of attention, the results, not only with the process indicator, but also with the results indicators, which are the results of this work at this level, at the central level, in different jurisdictions, and also from the ministry. Therefore, for us to measure from day one the implemented measures, it's useful to assess what we are doing as an organization in the country, but also to join the local authorities, to local professionals, to strengthen the information health of information systems of mental health. Now I will give the floor to my colleague Ayala, Narena Ayala.
Hola, buenas tardes. Buenos días a todos. Bueno, muchas gracias.
Good morning, good afternoon, everybody. Thank you, Liliana. I'm going to start with my part of the presentation that starts with this graph where we see a diversity considering the difference in the data gathering in our country. Argentina is a country that it's made by 23 provinces plus Buenos Aires City, which are 24 districts. This means that each of these jurisdictions has their own collection system through which they gather in their own way the data on their populations. In some jurisdictions or provinces, they also have electronic support, and in some others, they do this by hand on paper. Due to this heterogeneity in these gathering collection systems, especially in all related to mental health, in the data that we gather at the level of information and the scope of this program, which was relaunched in 2022, with all the information that we gather for all these provinces, we have very diverse information, which was adjusted to the local reality of each of these jurisdictions. So based in this information, during last year and partly this year, we built different indicators to measure the level of progress. We can see stages 1, 2, and 3 in different colors to represent that each province which are in this first stage are those that are now working on the analysis on the situation of the mental health services, this area in which they would like to implement this program to reduce the gaps in the healthcare system. So as of this analysis of the information, the idea is to have an operation plan on how to work and instrument the MH gap manual to adapt it to the own reality of each jurisdiction. We also suggest that it's very important for them to have a formal document to support the implementation of the program. For example, ministerial resolutions or special ministerial resolutions in order to support this in time. This gives a formal framework of working. On the other hand, there are some other provinces which are on stage 2 in yellow, which means that they already have a diagnosis, an analysis. They already have a plan on how to make this implementation work and are assessing on how to train specialists in mental health, preferably psychiatrists, psychologists, and physicians, which we denominate the first level, because these professionals are also trained that can implement this guide, family physicians, clinical physicians. The jurisdictions that are on the third stage, shown in green, they are already being trained in this guideline, which is composed by 8 modules related to mental health problems. And the idea is that each province may choose in which way to be trained so that professionals may have tools for support to make the first listening, to listen to the patients that come to the primary health facilities. And the fourth stage, which we are undergoing now in our country, working together with the Ministry of Health, is related to the implementation on the guidelines, the use of the tool by means of physicians and nurses, and also monitoring and assessment. In order to make this happen, we need supervision, for example, by means of the teams that are trained on mental health, this first tier of professionals that was trained at the first level. This is interesting because we were able to consolidate or agree on a tool to reinforce and improve the quality of the data that was gathering maybe more at a manual level due to the diversity that we have in the country, so we could reach an agreement on the tool that we will explain later. And we will have 3 provinces that will make this pilot test on how to implement this tool, so that next year we will move on and include the rest of the provinces, those that are already on stage 3. These levels are not static because they apply to the reality of each of these jurisdictions, of the resources that they have. There are some jurisdictions that can move faster than others. The most important thing
la
As
mayor
you
parte de las
see
jurisdicciones de nuestro
here,
país
most
está
of the
avanzando con la
jurisdiction in our
implementación de
country
este
is
programa
moving
que
forward the
fortalece el
implementation
primer
of this
nivel de
program
atención
that
y sobre
strengthened the
todo
first level of
fortalece que podamos recoger datos de mejor
attention
calidad.
or
Muchas
service
gracias.
that it's going that is being provided. Thank you.
Magalí, tenés el micrófono apagado.
Hola, muchas
Magali,
gracias, Luz.
think now
Bueno,
you need.
como comentaban mis colegas, para
As my
poder
colleagues
avanzar,
mentioned,
y monitorear
in order
hacer
to
la
move
evaluación
forward
de
and
la
to
intervención del programa
monitor
MHGAP
and
en las
assess
distintas
the
jurisdicciones
program
de nuestro país,
MHGAP
fue
in different
necesario,
jurisdictions in our
por favor,
country,
pasar a la siguiente diapositiva. Fue necesario que hagamos un trabajo muy articulado desde todo el
we
año
needed to
pasado
articulate this
con
work
el
from
Ministerio de Salud de
last
la
year on
Nación,
together
es
with
decir,
with the National
la
Ministry
Dirección Nacional de Salud Mental
of
y
Health and the
también los
National
miembros de la Dirección
Directorate
Nacional
of
de Atención
Health
Primaria y Salud
of
Comunitaria.
Mental
Se
Health.
nos presentaron, digamos, en esta instancia, cuando ya
So
queríamos medir la
at this
implementación
stage,
del programa,
when we
era
wanted to measure the
prácticamente
implementation of the
dos. Por un
program,
lado, no podíamos medir
we had
todos los
on the
aspectos
one hand,
que hacen al
we
programa, sino que
couldn't
teníamos que hacer un trabajo
measure
de
all the
recorte, de
aspect of
selección de
the
indicadores que lo
program,
hicimos
so
de
we
manera
need to
conjunta.
select
Y
specific
por otro lado,
indicators,
queríamos decidir
and on the
la
other hand, we
metodología
needed
de
to,
qué sistema
to
de
decide
recopilación de
which
información lograr,
methodology
¿no?
or which system we
Por
would
eso,
implement to gather
diferentes
data.
circunstancias y
So
situaciones,
due to
tuvimos
different
decidimos
circumstances,
de mutuo
we
acuerdo utilizar la
decided
herramienta RedCap, que si
mutually
después tenemos más tiempo,
to use the tool
podemos ayudar a acercar
RedCap
esta plataforma,
that I
que es
will
básicamente una
detail
plataforma
if we
web
have
que es gratuita,
time
que sirve
later.
a la
This is a free
investigación
tool
y
that
sirve también
is
a
used
utilizar
for
para las
investigation
instituciones que
purposes
realizan investigación o que hacen atención, pero
for
también investigación,
institutions
¿no?
that
Luego, si quieren, hablamos un poco
provide
sobre esta
services
plataforma
or
si
that
hay
also
tiempo, pero un poco
make
queremos
research.
contarles por qué la elegimos, ¿no?
So
Nos
why are we
parecía que
using
era, en
this
primer
tool
lugar,
RedCap?
más amigable
In the
que a lo
first place,
mejor,
it's
como nos había
much user
pasado de haber
friendly
enviado tablas Excel con los indicadores
because sometimes
seleccionados el
we
año
used
pasado y que
Excel
no
sheets,
contestaban las provincias, ¿no? Quedaban
and the
como muy
provinces, we didn't
se
have
diluyeron, se
any
diluían. En
replied
cambio, esta
in these
herramienta lo
sheets.
que nos
But
permite es, por un
with
lado, no
this
solamente por
tool,
lo amigable, sino porque permite
we
una sistematización de la recopilación de los
can
datos
have
y
a
permite
systematic
al
data
a la
collection
entidad que la
because it's
administra, en este
very
caso el Ministerio de Salud de la
user-friendly,
Nación,
as
poder
I
hacer un
mentioned,
seguimiento y no
so
tener
we
que
can
estar
make
haciendo
a
un trabajo
follow-up
constante, llamar para pedir
automatically
datos
and
y
not
saber cómo vienen con
calling or making a
poder
thorough
interpretar la información.
follow-up through
Por
the
otro
Excel
lado,
sheets.
también fue clave el hecho de que el
Moreover,
Ministerio ya las estuviese utilizando
it
para
was
otros
key
proyectos
that
y
the
además
ministry was
cabe mencionar que
already
esta
using this tool for
RedCap
other
es muy
projects.
segura en términos
This
de
is a
protección de la
very
información
safe tool
y de
in
la
terms of
seguridad del
safety of
procesamiento informático.
information or
Pero
information
bueno, fue
protection.
clave en un punto para nosotros, no solamente poder,
For
llegado
us,
a este grado de avance, ¿no? de implementación del programa,
to reach
medirnos,
this
es decir, poder analizar, evaluar
point
nuestro
of the
trabajo y hacer
information,
de eso,
being able
hacer los
to
ajustes
assess
necesarios,
our
¿no?
work in order
Planificar
to
o
make
corregir lineamientos, sino
adjustments
también
or
poder,
to
a través
redesign
de
what
la
needed to
selección de
be
indicadores
done,
priorizados, acompañar y fortalecer lo que
we
tiene que ver
could
con los sistemas de información, en
provide
este
support or to
sentido, de
strengthen
salud
the
mental.
information
Y fue
systems that are
clave el
related, in this
acuerdo que
case, for
hicimos
mental
con
health.
el Ministerio de
We had a
Nación,
key
porque
agreement
ellos
with the
nos
Ministry of Health
articulan,
because
como
they
explicaba anteriormente mi compañera, en
can
nuestra organización del sistema de nuestro país,
articulate
son ellos los que articulan con el nivel subnacional, es decir, con cada
with
una de las
at a very
jurisdicciones,
national
y
level
es
because they can reach to all
o
jurisdictions
comunitario, sino que resguarda la información
and they
en la nube
safeguard
ARSAT, que es
the
el Servicio de
information
Telecomunicaciones del
in
Estado
the
argentino,
cloud of
donde estos
ARSAT,
datos
which
están
is the
sistemáticamente
cloud
almacenados.
of
Es un
the
poco
Argentine information system.
queríamos mostrarle esto. Si quieren podemos pasar a la siguiente diapositiva,
So
por
I
favor.
will
Estos son los
show
indicadores
you
finalmente
the
priorizados,
indicators
que
that we
básicamente
finally
atienden a los aspectos que
priorized,
queríamos medir en esta primera
which
instancia, la
aimed at
sostenibilidad
the
del
aspect that
programa,
we
a
wanted
las
to
áreas
highlight
geográficas y administrativas de implementación de
according
las
to the
instituciones,
different
el alcance
geographic
en
and
términos del
economic
personal
area
capacitado no especializado en
in
salud mental,
terms of
la
the
posibilidad de
professional
identificar
train
en qué
on
nivel
train
del
on mental
programa
health.
se se avanza en la identificación de personas con condiciones de salud mental
we were
en diversas y
able
continuas
to
circunstancias. Y por
see
otro lado,
which
después,
was
las consultas de salud
the
mental
rate
se
of
pueden
people
hacer
affected
citas
by all
especiales.
different
Pero bueno, no nos
mental
vamos a detener aquí. Vamos a avanzar con la próxima,
diseases.
por favor.
This shows all the
Este es
information,
un
the indicators
ejemplo
that we could
que repasamos
identify.
también rápidamente. Tiene que ver
This
como
is
un
just
ejemplo
an
de dos
example
preguntas que reciben a través de
of
este cuestionario
how,
RedCap,
with only
cómo
two
a partir de las
questions
respuestas que
of
las
this
familias dan,
in
se
this
puede
tool,
construir muy fácilmente uno de los
and we can
indicadores indicados.
reconstruct
Tengo
one
entendido que
of
esto
the
ya se puede automatizar
indicators.
desde la misma plataforma de
So we
RedCap.
could do
Nosotros
this
todavía no la hemos explorado
from the
suficiente,
platform
pero esto
RedCap.
también es un plus que otorga esta
So this is
plataforma, ¿no? La siguiente, por
very
favor.
convenient on the use of this platform.
Ahora bien, como mencionaba Liliana al principio,
As Liliana
nosotros
mentioned,
trabajamos, por un lado, en
we work
querer medir la implementación del programa de MHGAP y otra
on the
en
one
las
hand in the
herramientas que hemos estado
measurement of the
trabajando,
MHGAP
que contempla datos
program,
del primer
and
nivel de
on
atención
the
y
other,
también
the
incluir
data
datos del
in the
segundo
first
nivel
level of
en la
information,
herramienta
but
del
also
Ministerio de
on the
Derechos
second level,
Fundamentales de la Iniciativa
which
Especial
is
para la Salud Mental. Este set de
related
indicadores
to
que
the
les
special
menciono no
initiative for
solamente
mental
fueron
health
definidos a partir del
program that
trabajo
we
con las
have.
provincias, sino
We
también
defined this together
supervisados por
working
la
with
única
all the
NPS.
provinces
Estas
and
son las áreas
also
evaluadas
with OPS
principales de estos
central
indicadores.
offices. So these
Siguiente,
are
por
the
favor.
main areas that we identified.
Aquí lo que brevemente, seguramente no lleguemos a ver todos, pero
Briefly,
trajimos algunos datos, no
I
solo
will
no
show
para
you
analizarlos
some data, not in order
específicamente
to analyze them thoroughly,
en este sentido, sino para mostrar distintos
but
aspectos de los datos.
to show you
Aquí lo
different
que queremos
aspects
mostrar
of
es
data. Here, what we would like to show you
este porcentaje, este indicador es la cantidad
this
o el
that
avance
each
que hemos
indicator
tenido en
is
términos de cobertura
the progress that
efectivamente
we had in terms
disponible
of
para
coverage.
cubrir a población potencialmente
So how are we advancing
población
on
potencialmente cubierta por servicios de
supporting
salud mental en el
the
primer y en el
potential
segundo nivel,
population
en esta
through our
población
improved mental
Como
health
podemos ver, tanto en
services?
un año como en el otro, es bastante pareja.
As we see
Estos
for
datos muestran
different
la
years,
variabilidad
the
de los
information
trimestres.
is
El año
very similar. There
2021
are
es
some
azul, 2024
variability
es naranja, pero
from
todavía
quarter to
falta incluir el
quarter.
último trimestre del 2024.
We're
Pero lo
still
que tenemos que hacer es que
missing
para
the
poder
information from the last
brindar
quarter
esta
of
información
this year.
y tener resultados de este indicador, fue necesario recurrir
But
a una
in order to have all this
una serie de
information,
información que no
we
estaba
needed to have a
centralizada ni
series of
sistematizada en
information
una
which
sola
was
área
not
dentro de nuestros
centralized until now
ministerios de salud
through the
locales, ¿no?
Ministry
Sino que, por
of
ejemplo,
Health at a
necesitábamos
local
dar, por
level.
un lado,
So, for example, we
personal
needed
capacitado no
on the one hand,
especializado,
the trained
dónde estaba
professionals,
trabajando, en qué sectores del primer
in
nivel y
which
cuál era su población
in which
alcance.
area they were
Por otro
working
lado,
and
también
which was the
saber si había
population that they were
nuevas
in charge of.
incorporaciones en los
On the other
sectores
hand,
del
we
primer
needed to
nivel que
know if
pudieran ser
we have new
necesitados en el
hires
servicio.
in the
Y
area
también
to support
tener
this
ese conocimiento
program.
cuál era el
And also
listado
we
de
needed to
sectores
know
y su
which
población
were
alcanzable y en cuáles de ellos
the
estaba
factors
implementando el
and the
programa.
populations
Entonces,
and how
todo
they were
esto
implementing the
dificultó en un
program.
primer
So
momento
this
la
was very
captura, la
hard
obtención de los
at the
resultados, pero
beginning, to
con la
gather the
mayor
information,
dificultad lo hemos logrado y
but
como que se empieza
we
a
managed little
aceptar
by
los
little
procesos y los mecanismos por los cuales
to
llegamos a
start
finalmente
rolling all
conseguir la
this,
información.
putting into
Al
place all
principio
this
parecía
mechanism,
bastante desmoralizante porque no la
which
encontramos,
is
porque
at
quizás
the
es
very
exploratoria, pero
at the first
luego
place
con el
it's very
correr del
heavy, it's
tiempo y con
very
la
difficult, it's
articulación
discouraging
con las distintas áreas,
to
se han
articulate
tenido
with the different
compromisos
areas,
y trabajo de manera constante que permiten obtener esta
but the
información.
constant work allowed
Próxima,
us
si quieren,
to
pasamos a
move
la que
forward.
sigue.
So
Es
we
más o
move
menos
into the following slide.
la próxima. Ahí está. Esto ya tiene que ver con, gracias, con directamente no es un
This
indicador de disponibilidad, sino más bien
is
un
not an
indicador de
availability
accesibilidad. Es el único
indicator,
de los
but an
indicadores que nos permite
accessibility
ver la
indicator.
utilización
And this
de
is the only one that
servicios
allows us to see
de apoyo
the
psicosocial
use
virtual. En este
of
sentido,
the
en nuestro
tools
país no existen como tal, pero sí
for
existen, sobre todo a
psychosocial
partir de la
support.
pandemia, líneas telefónicas de apoyo
There
psicosocial que han
are
quedado instaladas.
records since the
Acá no se puede
pandemic,
ver que por
and
ahí
there are
desde el
hotlines for
2024 hay una
psychosocial support
reducción en
which
ese
have been
sentido
installed,
de
and there
uso.
is
Tal
a
vez no
reduction
debería
of
ser medido
in the
en
use,
estos términos,
but
sino que tiene que ver sobre todo
this has to
con
do
los más
mainly
amados
with the fact that there are delays in the recording of these calls. And this has an impact in terms of the migration from the system to the other. So the calls that are done, they are not generally loaded correctly into the systems. So at the end of the year, this may change, but we find these issues as well, because since we have to cut the information for today's presentation, well, we don't have real information, but there may be some registration that at the end of the year will we will show here. This indicator, which is the amount of people trained in the health sector, we had a lot of people, but only for 30% of less we could get the profile. But this is so as to know what these indications are for. In this case, it's for decision makers or policy makers, so as to see where our efforts should be placed. And up to now, they're focused on health services and in other people who are also very relevant and work health issues. We should work more in terms of the measurement and what is done at a community level. That was the objective of this slide. And what this slide wants to show, it's not only to mention that the organizations with which we generally work are NGOs, but it also shows the way ahead of us and the work with the civil society. Well, they are very much involved in advocacy for mental health, but we still have a lot to do so as to include social determinants and other things as well. We may move on. We have shown in the rest of the slides which have been the main advances or progress, the information of direct management. And we have also made great progress in terms of the indicator selections that we had to do together with the Ministry of Health, so as to measure that and to determine in which platform we were going to do that, but the conclusion is that it should be applied and integrated into health systems. So if we have better measurements in terms of the MH gap, and it also collaborates with special strategies. So there is a lot to do. I mean, nothing's easy, and the way sometimes is not paved, and sometimes you get disencouraged, but at the end, everything succeeds. Next slide, please. And this is what we have already mentioned in terms of the difficulties because of the inexistent data or the data that is not registered or not updated, but we can enter into agreements to obtain this data. Also, the information system fragmentation and digitalization proceedings that in some places we still work in paper. Next slide, please. As Liliana was saying at the beginning, we have a twofold objective. So on the one hand, we should measure what is it that we are doing and establish and plan and define which are the relevant aspects to measure in order to know how have been doing, and based on the information we should also make better decisions, but it also allows us to install mechanisms so that ministries can own those indicators and that they are integrated in their information systems. As I was telling you, with the data we've seen up to now, there is a lot of work to do, and we are very anxious because next week we are going to launch the monitoring and assessment tool for the MH gap in its pilot phase. I'm sorry if I rushed a little bit, but I know that we don't have much time, so thank you very much. Thank you, Magalín, Arena, Liliana, for the excellent presentation. I think it's a very good synthesis of a road from going from situations of lack of data. I remember that we talked on how to migrate data to electronic platforms and to have established platform for MH gap monitoring and for the monitoring of other initiatives. Congratulations for the progress made, and this is very great news for those teams who are facing the same problems. And in relation to this area, I wanted to introduce the project from to action. Daniela Rivera will make the presentation, who is from the PAHO WHO Center for the University of Chile for the Development of Services, Training and Investigation and Research in Mental Health. Thank you very much, Matías and team.
Vemos la presentación, ¿no? ¿Me confirman?
Can you see my presentation? Yes.
Perfecto.
Excellent.
Entonces, buenos días. Mi nombre es
So,
Daniela
good
Rivera,
morning.
soy
My name is
psiquiatra,
Daniela Rivera. I am
represento hoy
psychiatrist and I am
colaborador para el
representing
desarrollo de servicios
the
de salud
Collaborator
mental,
Center
capacitación y
for
investigación.
Mental Health
Paralelamente también
and
lidero el equipo de
Training
sistemas de
and
información de salud
Research, and
mental,
I
en
also
donde
lead
participo con
the
Rodrigo Casanueva, Carolina Trau y
team
Juan Yul, en un
of
desarrollo que espera
policy
impactar
and
en
mental
algunos
health,
equipos
and
de la
I
región.
collaborate together with
Y
other
también en
assistants
este
so as
proyecto
to
Enlazados
have an impact that
represento
can
al
have an
equipo
impact in the
de
session.
gestión
And
del
here is the
Servicio de Salud Occidente, es la zona occidente de Santiago,
health
y
management
ahí específicamente a las
for the
profesionales
West, in the
Marcela Lara,
western
Camila
area of
Vidal y
Santiago,
Daniela
and
Quesada.
Marcela Lara,
Sin ellos no
Camila
sería
Vidal, and Daniela
posible
Quesada.
la
Without
presentación.
them,
Y
this
siguiendo con la
presentation
línea
wouldn't
de
be
lo que hemos
possible.
conversado en el webinar,
And
en
following what we
Argentina
have
pudimos ver un
talked
desarrollo a nivel
about
nacional.
in the webinar,
Lo que
we
les voy a
could
presentar yo es una
see
experiencia
a
a nivel
national
local,
development,
pero que
and
sin
I'm
duda
going
de
to
la mano del
introduce
Ministerio de
this
Salud de
local
Chile y del equipo de salud
experience.
mental, seguimos los
But together
lineamientos
with
del
the
plan de
rest of the
acción
team,
con
we
miras
are
al
following
2030.
the
Vemos cómo este plan, como nos decía Matías,
guidelines
fortalece la investigación
of
y
the
los
action
sistemas de
plan
información. Pero es importante para nuestro equipo
for
reforzar
2030, but
que
it's
los sistemas de
important to
información deben
reinforce
estar en
that
línea
the information
con el
system
liderazgo y
should
la
be
gobernanza
aligned to
local,
the
con
leadership
ayudar
and
a
local
proporcionar
governance
servicios
and
integrados a la salud
to
general
help
y
to
accesibles a la población, e
provide
implementar
services
estrategias
which are
de promoción
accessible
y
to
prevención. Y
population and
esto
to
puede
implement
parecer,
strategies of
bueno, ya nos ha comentado el equipo de
intervention and
Argentina que hay muchas
promotion.
brechas
The
y muchas
Argentina
veces
team
podemos
has
ver
already
las
told us that
dificultades,
there are a lot of gaps and we may
pero
see the
de todas maneras
difficulties,
podemos
but anyway,
tratar
we
de
can
motivar a los
try
equipos
to
y
motivate
podemos ver
teams
también en el
and
plan de acción
In the action plan, we can see that it's possible to monitor this progress with some indicators, such as the one we see here, such as increasing the treatment for people with serious mental health, to reduce the suicide global rate, and to increase the number of countries with public policies and national plans on mental health. But today we wanted to talk on local implementation so as to get to these indicators or this data, because in the health arena, when we have needs, it's difficult to prioritize mental health. It's a problem which is still stigmatized, and it's difficult to to persuade decision makers, but we need them to be solid. In Chile, we have developed an information systems which are quite standardized to collect national data, but at the local level, these same data, they are well used. They can allow us to escalate management and development projects and to get to these intermediate decision makers in the hospitals or political decision makers, so that these processes really happen. And it's also important to work with the health teams who sometimes are exhausted because of they have to answer to different demands. And if they see the results, we can obtain new energies for this collaboration. And this project is an example of how to implement these projects. This was a critical aspect of the services of mental health and the urgencies in general, where the people with mental health issues go to or refer to, and the idea is to take initiatives that may be already being implemented, but they are disaggregated or they are not being prioritized, and we can take them in an integral way so as to create a system. I'm going to give you some context. The Western Service of Santiago is one of the main of the Chilean territories. It is made up by 15 districts. 10 of them are rural, and they are quite geographically distributed. So that's why we need services to be distributed as well. And we shouldn't, you should be coherent in the way we deliver those services. It has a population of near 1.2 million inhabitants, and it has a high level of social vulnerability, and this is a greater challenge. There are several conditions which are quite favorable in the territory. We have at least 36 primary attention centers, and each of them includes the treatment of mental health in specific plans, but also together with the health ministry. We're working on the implementation in general. We're working with doctors, social workers, and community agents. And the second level is also very well defined. This is the ambulatory responses, and there's a gap here, but we have 9. We should have more, and they are distributed all throughout this territory. There are some experts. There is a day hospital for kids and adolescents and another one for adults, and 5 hospitals in total, but one of them is a base hospital which offers all the services, included the hospitalization rooms for adults and kids and adolescents. So this is an opportunity to improve and to integrate mental health in these 4 general hospitals that have not deployed their services but they are not
Y
planning
como
to do
vimos en las
so.
presentaciones anteriores y también nos ocurre localmente, cuesta llegar a los
As we
tomadores de
saw in the
decisión.
previous
Sobre todo
presentations,
si son
and we have the same
personas
case, this
que
is very difficult to make the
han tenido
decision,
múltiples
especially
necesidades y entonces,
if
¿cómo
there are people
priorizo
that have multiple
salud
needs. So
mental
how do I
versus
prioritize
dificultades
mental
respiratorias
health
o
versus, for
versus una
example, difficult
dificultad
for
en acceso en el
breathing
número de camas o en oferta o en listas de
or
espera?
the
Y
access
entonces ahí
related to the number of
bonito de esta
beds?
movilización es que en un subterritorio
So in a
de
subterritory
Occidente en Santiago, en la
in
provincia de Melipilla,
Santiago, in the
tuvimos este
Melipilla
impulso y esta
province,
apertura al cambio desde la
we
comunidad.
have this opening from the
Esta es una
community.
fotografía de una jornada de
This is
salud
a photo
mental en donde
in the
estábamos
day
en el
of
Día
mental
Mundial
health
de la
that
Salud
we
Mental en octubre del
celebrated
año pasado.
the
Y aquí
the
invitamos
day
a
of
diferentes
mental health last
alcaldes,
year.
a
So
diferentes
here we
tomadores
have
de
different
decisión como
mayors,
directores de hospital y también a la
different
comunidad
decision
organizada.
makers, hospital directors, and the
Y
community itself.
era una jornada
So
sin
this
mayores
was a
contratiempos,
special
sin
day
mayores
without greater
resoluciones,
difficulties
hasta que
or until
intervino una persona clave de la comunidad,
we have
don
a key
Hugo, que
speaker from the
planteó
community, Mr.
interpeló
Hugo,
más bien,
who
y planteó
called
dos
upon
grandes
us
esferas.
and
Por un lado,
talk
le
about two
preocupaba
very
profundamente
important
la
topics.
forma en la que
On
el
the one
hospital
hand,
general
he was
que le tocaba
deeply
acudir
concerned that the
estaba
general
trabajando con la
hospital
salud mental.
in
Ellos
his area
observaban que
was
era
working with mental
insuficiente para
health
la demanda.
because he
Y
saw
por
it
otro
was
lado,
inefficient
también
for the
ofrecer un
demand.
trabajo
And on
integral
the other
para
hand,
poder
how they are
ayudar
going
a
to
los
offer
vecinos,
an
para
integrated
poder
work to
estar
help
más presentes como
his
comunidad,
neighbors
pero
so they could be
declaraban
more
que
present at the
no tenían
community
mayores
level,
herramientas.
but they didn't have enough tools.
Efectivamente, luego de esta intervención y de otras
After
intervenciones,
this
en el
intervention
café
and any
posterior
others, when we had a coffee
pudimos
afterwards,
desplegar
we
algunas
were
ideas con
able
director
to
de
do a
hospital,
brainstorming together with the
alcaldías y
hospital
otras personas
director,
que
with the
nos ayudaron en
mayor,
estos procesos.
and with other
Y
people that helped
entonces,
us
por un
unlock
lado, se
this
está
process.
desarrollando durante este
So on
año
the
el
one
24
hand,
el MH
we
Gap
are
comunitario en esta
developing
zona,
the MH
perdón
gap,
que no me voy a
the
extender en la
community
presentación,
MH gap,
y lo que hoy llamamos
and on the
proyecto
other hand,
Enlazados,
with what
que,
we
como ya les comenté,
call the
es
program
un
Enlazados or
sistema de
Interlinked,
respuesta integrada
which
para
is a
mejorar
system
las
of
consultas, la
integrated
acogida de las
response
consultas de salud mental en
to
servicios de
improve
urgencia.
mental health
Y no solo eso, sino que el desafío es
consults in
favorecer la
emergency
continuidad de cuidados
services
con foco en
in
situaciones de
order
alta
to
gravedad.
improve the
Y dentro
continuity
de estas
of the
situaciones,
provision of the services,
la suicidalidad, ¿no?
which would also
Aquí
include
para graficar,
suicide.
el
In order
Ministerio de
to
Salud de
give you a
Chile
graphic
busca evitar la
overview,
fragmentación,
the Ministry of
que
Health in
todos los
Chile
territorios, todas las regiones, todas las
is seeking
microáreas cuenten con una red temática
for all the territory
territorializada
to have
con 3
a
niveles de atención, que esto es lo que
thematic
ocurre en el territorio occidente y en otros servicios de salud del país. El
attention
foco
in
de
this.
Enlazados está
So the
en
focus of this
urgencias de
Enlazados
hospitales
program,
generales
it's in
y
the
conectar
ER in
con
general
unidades de
hospitals
psiquiatría
that
enlace,
should be
en una
linked
primera etapa
to
al menos. Y
psychiatry
desde aquí,
units.
generar la
So
continuidad de
from
cuidados
here,
en red.
we would
Todo
add to the
este territorio y
continuum
toda esta
of
red
the service.
temática de salud mental está
So all
integrada
this
a la Red
territory is
General de
supposed to
Salud.
be integrated
El
into
desafío
the
era hacer
general
esto de
health
manera
network.
priorizada,
So the challenge would be to
rápido y
prioritize this,
además
to make this
humanizada.
quickly, and
Y no
also
era
in a
posible
humanized
hacer
way.
eso si es que
So it
no
wouldn't
teníamos desde la
wouldn't be
mesogestión
possible
un trabajo mucho más dirigido
if
con los
we
equipos
didn't
clínicos
have
y con los equipos de
a,
la microgestión de los
prior
diferentes
work with the
equipos de
clinical
la red.
teams and the other
Entonces
teams of
aquí
the
lo
network.
que
So here,
pudimos observar en primera instancia fue
what
que
we
no
saw in the first stage
necesitábamos inventar mucho más,
was that
sino que existían
that
ya
we
estrategias
already
conocidas,
have existing
recursos
strategies,
conocidos, pero que podían estar
known
cruzados,
resources
desagregados o fragmentados.
that
Por
were
territorio,
fragmented
por
or
nuestra dispersión
disaggregated
geográfica, no necesariamente
because
los
we
equipos
have
se
a
comunican
vast
entre sí.
territory and
Entonces,
teams are not connected
necesitábamos tomar
among
estas
them.
herramientas y tomarlas
So
como
we
un
needed
sistema.
to take those tools and to
Del
make
mismo
them
modo, estaban
into a system.
ocurriendo algunas situaciones
At the same time,
de desarrollo local,
we
como por ejemplo los
had some
distintos
local
desafíos.
development
Y la idea era poder proteger estos desarrollos
strategies for
y
for example, the Enlace program.
que pudieran generarse de una manera más orgánica,
So
organizada
we
y
needed to
coherente.
organize
Al
this
involucrar
in
a
a
los distintos
coherent way.
locales,
So when we
también
involved the
buscamos
local
que
teams,
exista este
we were
sentido de pertenencia
seeking to have this sense of belonging and this coherence and
No
consistency.
siempre, de hecho, la mayoría de las veces es muy difícil
Because most of the
continuar
times it's very
integrando la salud mental y
difficult
la
to
psiquiatría
keep
a la salud general.
integrating
Por lo tanto,
psychiatry and
la
mental
sostenibilidad
health
es
into the
algo
general
clave.
healthcare system. So
Y con
this is
ello,
key.
seguir motivando a los equipos de trabajo,
So we need to keep
mantener el compromiso ya
fostering the
obtenido
working
de los
teams to
tomadores de
encourage
decisión
them and to have
lograr que
the
este sea un
results.
proyecto reconocible. Por eso
So
el nombre de Enlazados.
we
Muchas de las
need
iniciativas que yo les voy a
this
contar
program to
ahora,
be recognized. That's why the name,
están a
Enlazados,
nivel nacional.
interlinked
No,
at a
no es nada
national
muy
level.
novedoso nuevo, pero la forma de trabajo con
But we needed to
los
implement
locales
this
es lo que
new
puede
way of
y
working with the
puede hacer la
local
diferencia en un
teams.
ecosistema
We
altamente
knew it would
demandado.
make the difference
¿Y desde dónde
within a
partimos
complex
este desarrollo?
ecosystem.
De los
So
datos,
which was
de
the
lo que nos
base?
podía entregar
We were
el
based
sistema de
on
información de salud
the
mental local.
data
¿Y qué sabíamos?
that we have on
Sabíamos
the
que
local
en
mental
Melipilla,
health information
esta
system.
zona
We
de
had, for example,
Occidente,
Melipilla,
desde
this
donde nos
sub
interpela la
area
prueba, al
where we
2023,
started up to 2023.
habíamos observado 117
We
muertes
observed
por suicidio. En 1996 eran las defunciones a nivel nacional,
almost
600 en lo metropolitano y
2,000
más o menos
diseases
117
due to suicide
en
at the
Melipilla.
national level and
Entonces, dijimos con los
117
equipos, ¿qué
in this
hacer con esto?
region.
¿Cómo vamos
So
focalizando y
how are we
priorizando
going
a
to
nivel
focus
local
and prioritize
cómo
this
usar
at a
líneas
local
abiertas al
level?
mismo tiempo?
Because we have
Entonces, ¿dónde
several
ponemos la
lines
fuerza de
open at the
tarea?
same time. So
Pensando en las urgencias.
which would be the focus?
Y así aparece el primer elemento de 8
So
de
there
lo que
came
hoy
the
es el
first
sistema Enlazados.
element of
Este
eight,
primer elemento entonces también se basa en sistemas
which
de
is composed
información,
the Enlazados
registros y
program.
vigilancia epidemiológica.
So it is
¿Qué
epidemiology
necesitamos para la vigilancia epidemiológica? Hacer una alianza
records.
con la Seremi
So what do we
regional
need? We need
ministerial,
an
que nos
alliance with
provee
the
el
local
aparataje para la vigilancia epidemiológica,
ministry
y también
for
tomar la mano a los
epidemiology
tomadores de
surveillance
decisión y
and to have the
contratar
decision
personal para
makers
los
to
sistemas
bring
de
them
turno
onto the
en el hospital
table
general,
so that we
generar
can have
capacitaciones locales para la
people at the
vigilancia
general
y
hospitals.
generar
We have
también
people
visitas a
specialized
otros
in the
centros que ya
surveillance
tuvieran implementadas
and
iniciativas
also
similares.
a
Al
system
mismo
of
tiempo era
referrals
importante
to
la
specialized
sensibilización del personal
institutions.
general.
So the importance was
Entonces,
the
este
training
primer
of the
elemento de
general
Enlazados
staff.
se ancla en la vigilancia centinela de
So
intentos de
our
suicidio,
program
con la
is
finalidad
based on
en la
this,
provincia de Melipilla inicialmente,
on the
estamos conscientes,
identification of
la
the
finalidad de orientar,
suicidal
focalizar,
person
evaluar y
in order to
reestructurar
focus,
acciones de
assess, and
prevención y control
restructure
en el contexto de prevención de
actions
suicidio y otras
for
situaciones de alta
suicide
gravedad. Entonces, la
prevention
vigilancia
or any
incluye un
other
elemento
severe
de recolección de
situation.
datos, que algunos
So
son
we
datos
have a
generales para
surveillance
poder
which is
hacer la
based,
contactabilidad,
which
y otros datos son
gathers
más
general
específicos
information, and
para
then we
poder
move into
generar un
specific
manejo de
data in order
situaciones
to
lo que les comenté previamente,
handle
la continuidad del
situations
cuidado
as
o
a
el
network
tránsito del usuario en
within
esta
the
red de
continuum
diagrama
of
que les
the
mostré hace
care,
unos
as I mentioned before.
Si nos vamos específicamente a lo que nos convoca hoy, que son los
If we
sistemas de
go
información en salud mental,
specifically
en este
to what
proceso
we're talking today, which is
ven
information systems,
desplegados diferentes
we
elementos. Primero,
see
las personas.
different
Sin las
elements.
personas
First
no
of all,
logramos nada.
people. Without
Y luego,
people, we can't do
la recolección
anything.
de datos en
Then,
los registros generales de
data
urgencia por los
gathering
equipos generales, y aquí es muy
within the
importante el
emergency
diagnóstico
general
y la
records,
codificación CIE.
because here it's very
Luego,
important the
tenemos el
diagnosis
boletín
and codification.
epidemiológico
Then we
bien
have the
característico que
epidemiological
se trabaja a nivel
newsletter,
nacional
which
con las
is
Seremis de salud,
specific as
con
at a
información
national
relevante
level
sobre
with
suicidalidad
important
y
information
que es trabajado
about
en el momento,
suicide,
que es enviado en el momento al
which is
referente
work
del Departamento de Salud Mental Occidente
at
para,
a
desde la
daily
notificación,
basis and is
generar
referred to
todas
the
las acciones
specialist
para
in
una
order to
continuidad de cuidado, para una
implement
atención
all the actions
luego de
necessary
ese
for
punto
the
en que la persona
continuum of
consulta
care
emergencia.
in this
Y
specific
también se
item when the
involucran acá
person
los
comes
equipos y
to
los
the
sistemas
emergency
de registro local de
department.
las fichas
Then we
clínicas
have
de
the local
hospitales y centros de
registry
salud mental
in
comunitaria.
clinical and
Acá
community
estamos
hospital
en
and
tránsito.
centers.
Algunos centros,
Here we are in
2 o 3
transit.
todavía están con ficha de papel, pero eso no es un
We
impedimento. Y
somehow,
otros ya, la
in some
mayoría
centers,
ha
we have
avanzado
manual
a
records,
procesos integrados
but most of
que
them
reúnen los datos de manera
already
mucho más
have
tecnológica.
electronic records.
Actualmente también a nivel nacional
Nowadays, also at the national level, these epidemiological newsletters are sent by email, and they are migrating into an integrated national system which will make our work much easier. So what we identified. So we have 77 notifications this year, which were mainly women. It was very noticeable that most of the people, 73% of the people had prior suicide attempts. 88.2 have priors of mental health issues. And this was very important because they didn't have, almost half of them didn't have any treatment at all. So what do we do with this data? So what we defined, I'm sorry to interrupt you, but you have a couple of minutes left. So we are going to refer these people to the psychiatry teams. So this first element became the second component that we hope to make progress during 2025, which is the organization and of emergency systems, and then move on to follow-up and training, and also to move on to teleservices, a digitalization of records. Here we have different tools that and the people who are working. And to finish, I would like to highlight that the key points of this mental health information system are applied into this program, the program Enlazados, through which we were able to implement governance and leadership. We could make monitoring with a proper data collection, and we hope that all these initiatives, among any others that we have throughout the country, it's going to improve the mental health of all the people in our territory. Thank you. Thank you very much, Daniela, and all the people from the team Enlazados. So I hope we can share this experience. We have more than 450 people here today, and that can make the best on how your process that started as as an idea ended up being a program of information and monitoring that could be implemented in other countries under different circumstances. Thank you very much for the presenters. You all have your cameras on, because now we are going to move into the Q&A sessions from our audience. We have questions for Ramon about how often the data is updated and which are the sources of data that we have on the link that you mentioned. Again, good morning, good afternoon, good evening. Data come from different sources. We have a main source that provides information relating to mortality for each disease, the epidemiological aspect of all the different diseases and conditions. And these are health world estimates. These are comparable data that every approximately 2 years that the WHO produces. Currently, these estimates that we are using in our link are series from the iteration from 2019. However, we are in the process of updating these areas with the most recent iteration that provides information from
Esto con relación
2000 to
a las medidas
2021.
epidemiológicas,
This in terms
epidemiológicas de mortalidad y carga
on
hospitalaria.
epidemiology
Ahora,
measures
hay
per
otras
disease.
fuentes,
Then we have other
las que tienen que ver fundamentalmente con los
sources that are
factores de
related
riesgo de enfermedades no
mainly to
transmisibles,
risk factors
donde
of
vienen
NCDs,
tanto
sorry,
algunas de la Organización Mundial de la Salud y otras
some from the
de centros colaboradores
WHO
que
and from
de la
other
Organización
from
Mundial de la Salud que se
collaborators
encargan
for
de
the World Health
producir
Organizations that are
esas
in
estimaciones.
charge of generating
En
these
este caso,
estimations.
esas estimaciones
In this case, those
se utilizan como
estimations
fuente de datos
are
primaria,
used as a
fundamentalmente para los
primary
estudios
data
de base
source,
poblacional, estudios
mainly
epidemiológicos de
studies
prevalencia de
based
base
of
poblacional o poblacionales
epidemiology prevalence
y
based on
actualmente
populations,
están actualizadas
which are
hasta las
updated
estimaciones más recientes disponibles
until the
de cada
most
uno de los
recent
factores de
estimations
riesgo.
available
Aquí lo
for
que
each of
sucede
the
con los
risk
factores de riesgo es
factors.
que las
What
estimaciones
happens
no
with
se producen
risk factors is that
simultáneamente para todos los
estimations
factores de riesgo,
doesn't
sino que
happen
puede ser que haya
simultaneously
un
for
factor
all
de
of them,
riesgo
but
que
there
se
might be some,
actualizó, como
for example, risk
recientemente
factor that
tenemos
it was
estimaciones
already
de
updated this year,
obesidad y de
for
inactividad
example,
física y
obesity
de diabetes
or
que recientemente se han actualizado.
diabetes
Sin embargo,
or physical
otros no
education,
están actualizados al mismo
but some
nivel
others, for example, are
de
not
obesidad y
updated
riesgo, ¿sí?
up to the same
Perfecto.
level
Perfecto.
as
Hay
this.
otras fuentes que tienen que ver con
There are
indicadores
other
de
sources that
monitoreo
are
de planes
related
de
to
acción, etcétera, que esos
monitoring of
tienen
action
otra frecuencia,
plans
por lo general
that have different frequency,
anualmente se van
that are
actualizando, y lo que
updated
puedo asegurar es
annually,
que los que están disponibles
and
están
that
todos
I
actualizados.
make sure that
Con
what
relación
is
a salud
available,
mental,
everything is updated. In terms of mental
los
health,
datos del Atlas de Salud Mental
the
corresponden
data
a
on
la
the Atlas
aplicación del Atlas la etapa de colección de datos del 2020.
are related to the
Ahora mismo
2020
tenemos las medidas de
data
mortalidad y
collection.
carga de enfermedad
Now we
de
have
trastornos
mortality
relacionados
and
con salud mental
burden of diseases related
que
to mental
corresponden
health
a la iteración anterior del
from
estudio
the previous
de las estimaciones mundiales de salud, pero que
iterations,
pronto van a estar actualizadas hasta el
but they will
2022.
be updating very
Muchas
soon.
gracias, Ramón. Sirve mucho y efectivamente se van actualizando y esperamos entonces tener datos más frescos en los próximos
Thank
meses.
you very
Al
much.
equipo de
Yes, they
Argentina,
will
aparte de los
be.
agradecimientos y el apoyo, si han pensado en la implementación de estrategias o mecanismos que incluyan a los usuarios o personas con experiencia propia en la evaluación, diseño o implementación de los registros de salud mental. Magalí lo alcanzó a comentar de la importancia, pero a lo mejor algunos comentarios breves acerca de cómo esto se podría integrar en la implementación de estrategias específicamente con personas con experiencia propia. Adelante.
You have the floor.
Gracias por la pregunta. Por cierto, muy atinada. Por
Thank you for
supuesto,
the
no es una tarea
question.
fácil porque en realidad las
Yes, this is not an
organizaciones
easy
de
task
personas
because
con
the
experiencia médica,
organizations of
familiares,
people
necesitan todavía de mucho respaldo, de mucho fortalecimiento en el
with
país,
different situations
a pesar de
need
que
a
están
lot of support in the
incluidos en
countries,
órganos
even
de
though they are
gobierno
included
importantes que están
in
instituidos por la Ley Nacional de
country
Salud Mental.
bodies that are instituted by
En
the mental
cualquier
health law.
caso,
In any case,
quizás una de estas experiencias se
maybe
pueda
one of these experiences may be
introducir a partir de una experiencia
introduced
piloto que estamos empezando
through
a
a
trabajar
pilot
con el
experience we are
Instituto
starting to
Colaborador de
work with
Chile
together with the coordination center
la
in
herramienta de
Chile
calidad y derechos
on
que va a
quality
permitir
and rights tool that
en
will allow
una
us
experiencia piloto
in a
probar
pilot
el
experience to
funcionamiento
test
involucrando
the
usuarios
functioning of the tool
tanto
involving
como
users,
profesionales de los mismos
both
servicios.
professionals of
Esa
the
es
same
una de
services and not. And
de las
that is
acciones
one of the actions
que proponemos. En definitiva,
that
todas las
we are
políticas de salud mental,
proposing.
según prevé la ley,
All
tienen
the
que tener
mental
el
health
consenso
policies, according to
del
law,
Consejo Consultivo Honorario que
have to have the
existe,
approval of
instituido por
the
ley en el país, y que
Honorary
involucra
Consulting
también a las
Council, which
asociaciones de
also
usuarios y familiares de
involves
usuarios.
users and
Pero sí,
family of
reconozco que hay
users
mucho más
associations. But
trabajo por
yes, I
hacer en ese
do
sentido.
acknowledge that there is a lot of
Muchas
work to be
gracias,
done
Liliana.
in that
Del equipo de
regard.
Argentina y
Thank you
una
very
última
much,
pregunta
Liliana. And a last
a Daniela del
question
equipo de Chile.
for Daniela. from the team of Chile. There is a question in terms of the challenges of the information systematization, and mainly in terms of suicide prevention. Which are some of the relevant elements that should be included for reducing these suicide rates? And so what are the actions then?
Gracias, Matías.
Thank you,
Bueno,
Matías.
en términos de
Well,
sistematización,
in terms
yo te
of
podría decir que las
systematization,
principales brechas que hemos
we could
encontrado
say that
es
the
poder
main gaps we
priorizar
have
los recursos,
found
es
is,
poder
well, to
focalizar
be able
en
to
cuáles son los
prioritize
desarrollos en un
resources and to
determinado
focus on
territorio
the
o en un
development in
determinado
certain
país
territories or a certain
quiere llevar a
country,
cabo,
or that
y
a
por lo tanto
certain
desde
country
ahí
wants
poder
to carry
definir
out, and to
cuáles
be able
son
to define
los
which
trabajos
are
con los
the
profesionales o con indicadores
how we can
para
work with
poder poner los
professionals or
fuertes de
the
tarea en una
indicators
determinada
in
tarea.
order
De otra
to
manera, nos vemos enfrentados
focus
a
on a the
200
specific
más
task,
de 100
because if not,
indicadores y por lo tanto nos cuesta
we
mucho avanzar.
have
Entonces, la
plenty of
sistematización creo
indicators and
que
it's difficult to
priorizar
move
es importante.
forward. So I
En
think
un
that
marco,
it's
por
important
supuesto,
to
de desarrollo de
prioritize within
servicios
the
de salud
framework
mental en
of mental
el
health
sistema general
services
de salud.
development in
En
the
términos
general
de
system, in the system as a
vigilancia
whole. In
epidemiológica,
terms of
es
epidemiologic
absolutamente necesario poder
vigilance,
llegar a
it
estos
is,
lugares en
or
donde vamos a hacer la mayor
surveillance, it's
pesquisa.
important to get to those
Entonces,
areas where we're
es
going to
importante poder
have the
vincular
greatest
primero los
service. So
equipos
we have
de
to
urgencias de atención primaria o
relate
de primera respuesta de
the
atención primaria y
primary
también en las urgencias hospitalarias para poder
agency
estar
team
primero
and the
capacitados de manera
ER
clínica
rooms so that
en
they can be
poder
trained
identificar a las personas que requieren
to
apoyo
be able to
y
identify the people
poder
that
también estar
require
capacitados
support
en la
and
forma
to be
de
trained
identificar
in
si
terms
esta
of
conducta suicida realmente requiere un
identifying
levantamiento de
with whether
vigilancia o
this
requiere activar toda la
suicidal
cascada de procesos. Y eso va
behavior
de la mano directamente
requires
con la capacitación.
vigilance or the
En
activation
el
of the
dato, yo
whole
te diría que
process
más allá
cascade.
de el gran abanico de
Beyond the
información que
great
pudiéramos
amount of
recoger,
information
lo
that
más
we may
importante es que
gather,
el dato
I
esté
think the
bien
the
tomado
main thing is
clínicamente
that
y
data
técnicamente y que haya una
is
respuesta
well
de red,
gathered
en el fondo
clinically
que
and technically,
la red de
and
servicios
to
pueda
have
absorber
a
esta demanda y pueda dar una
support network
respuesta
that can
unificada
absorb this
en el
demand and
momento en
can
que se
provide a
necesite.
unified response when needed.
Muy bien, quiero agradecerle a todos
Well,
los
I would like to
presentadores
thank
la
all the
discusión.
people
Está muy interesante. Quedaron
present.
algunas preguntas
The
que
discussion
lamentablemente
is
no pudimos
very
incluir por un espacio de
interesting. There
tiempo,
were
pero
some
sí
questions we
pienso
couldn't
que
include
este
because
webinario
because we are running
permitió
out of time, but
incluir
I
tres
think this
presentaciones
webinar
que
allowed
fueron
us to
sumamente
include three
valiosas.
presentations that were
Nos han entregado una visión que es
really
comprensiva sobre la transformación
valuable
de los servicios de
and
información en
have
salud mental,
provided us with a
con
comprehensive
una
vision on
experiencia,
mental
¿cierto?,
health
en relación
and
a
in an
disponibilidad de
experience
datos
in
y
relation
plataformas
to data
disponibles para los países de
availability
la
and
región,
the platforms
que ha requerido
available
mucho
for the
esfuerzo
countries in the
de Ramón
region
Martínez, y
that
le
has
agradecemos el trabajo,
required a lot of
con una
effort from
experiencia
Ramon
argentina
Martinez, and we
presentada
would
por
like to
Liliana Urbina y su equipo,
thank
que
him,
muestra los avances
and
concretos en la
the
implementación del
experience from
MH Gap,
Argentina told
resultados
by
medibles, con
Liliana
más de
Urbina and her
9.100
team with
profesionales de la
MH
salud
Gap
y una
and
cobertura
with
potencial de
lots of
640.000
health
personas en un
professionals and
primer nivel de atención,
140,000
resultados que son
people
medibles
coverage,
gracias a
and
una
these results are
innovadora
measurable
plataforma de
thanks to
monitoreo y
its
evaluación,
innovative
que
platform
representa
of
un ejemplo
monitoring
de
and
cómo la
assessment. And
tecnología puede
this
fortalecer
provides an example
nuestros
of
sistemas
how
de información.
technology can
Y una presentación
strengthen our
también sobre
information
los
system,
sistemas de
and
información
also
como
a
pilar estratégico,
presentation on
donde
information
Daniela Rivera
system as
nos presentó
strategic
una visión
pillar,
integral
where
de
Daniela
cómo se
Rivera gave
puede
us a
transformar la atención en
comprehensive
salud
vision
mental,
on
destacando
how
elementos como la
these
gobernanza,
can be
infraestructura tecnológica
transformed,
y la
outlining
sostenibilidad.
elements
Estas
such as
presentaciones refuerzan
sustainability.
mucho el mensaje
And these
central que tenemos que los sistemas
presentations
de información
reinforce the
robustos son
main
fundamentales
message
para alcanzar las
we would
metas
like to
del Plan de
convey,
Acción sobre Salud
which
Mental
is
y de
important to
Desarrollo
reach
Sostenible.
our
Quiero agradecer a todos los presentadores,
goals
al equipo
on
técnico,
sustainable
a los
development.
traductores
I would
y al
like
equipo de
to thank
comunicaciones
the
que nos
team,
ayudó a poder
the
hacer posible
technical team as
este
well, the
webinario. Y por
presenters
supuesto,
and the
a todos los
translators,
participantes, las
and
contribuciones
to all
fueron
the
fundamentales
participants
y van
for
a
your
ser para poder
contributions,
seguir
which were
avanzando en este importante
key
reto que es
to, and they
en la
will keep
transformación de
on
salud
being
mental en las
essential to
Américas.
move
Muy buenas
forward
tardes a todos.
in the
Que
promotion
tengan un
of mental
excelente resto de
health
día.
in the Americas. Have a nice rest of the day. Thank you very much, everybody.